Hi, good afternoon. Thank you for joining today live Q&A with WHO. It's working from home edition. We're all working from home today. I'm your host, Sari Satyogi from WHO Department of Communication. And with me today is Dr. Pura Raiko Solon, a scientist in WHO's Department of Maternal, Newborn, Child, and Adolescent Health and Aging. And we're going to talk about a very important topic, breastfeeding and COVID 19. We know a lot of mothers and healthcare workers who support them have many questions about whether it is safe for mothers with confirmed or suspected COVID 19 to be close to and breastfeed their babies during the pandemic. WHO has recently published a list of frequently asked questions about breastfeeding and COVID 19, which provide information for healthcare workers and families about um, uh, a protective effect of breastfeeding and skin to skin contact. Um, and the harmful effect of inappropriate use of infant formula milk.
Formula.
So, yeah, so Pura, let's talk about those FAQs.
Okay.
Um, yeah, so COVID 19 is currently spreading around the world, and many mothers have concern, like what I said earlier. So, should mother actually continue to breastfeed if COVID 19 is prevalent in their communities? Can you tell us?
Yes, if COVID-19 is prevalent in your communities, yes, definitely you should continue breastfeeding. Live COVID virus has not been detected in breast milk, and there's no evidence of transmission of COVID-19 through breast milk. So there's really no reason to avoid or stop breastfeeding. Breastfeeding improves survival, provides lifelong health and development advantages for newborns and infants, and has health benefits for the mothers as well.
Right. And I think the biggest concern is whether COVID 19, the virus that caused the
Yes.
disease, can be passed to
Mm-hmm.
breastfeeding. What do we know about that so far, Pura?
Mm-hmm. Okay, so we know that there's no evidence of transmission of COVID-19 through breast milk or breastfeeding. The live COVID-19 virus has not been isolated from breast milk in any mothers who are confirmed or suspected to have COVID-19. Some we know of two breast milk samples that have been positive by RT-PCR for COVID-19, and this means that we can see RNA particles in the breast milk, but these are not necessarily viable virus. So again, there is no live COVID-19 virus in breast milk or breastfeeding. There's no evidence of transmission through breast milk or breastfeeding. And the breast milk, as you know, and breastfeeding imparts numerous substantial health and development benefits for both the infant and the mother.
Mm-hmm. And if then a mother decided to continue breastfeeding, is suspected or confirmed with COVID
Yeah.
19, what
Yeah.
are the hygiene recommendations that she should take
Mm-hmm.
to protect
Mm-hmm.
the baby?
Okay, so to protect the baby through droplet transmission of droplets from droplet transmission of COVID-19, the mother should frequently wash her hands with soap and water or alcohol-based hand rub. She should wear a medical mask, and this mask should be replaced once it's damp. It should be immediately disposed of. It should not be reused, and do not touch the front of the medical mask. Also, it's important when you're coughing or sneezing to cough and sneeze into a tissue, dispose of this tissue, wash your hands again, and also to clean surfaces, clean and disinfect surfaces that you touch frequently. Yeah.
Okay. So maintaining the hygiene measures, then a mother
Yes.
can
Yes.
breastfeed
The
safely.
infection prevention and control measures. Yes.
Yeah. I think we started getting some questions here. I'm going to
Uh-huh.
read some questions. We got a question from um, Alvin Mamari asking about if there is any proof that breastfeeding doesn't transmit coronavirus. I think you answered about this a little bit earlier. Maybe you can repeat again.
Yeah.
For
Yes.
Mhm.
Yeah. Yes, of course. So indeed, we are seeing WHO brings together experts from around the globe to discuss the latest evidence, and WHO continues to be on top of this evidence. We provide guidelines around breastfeeding and COVID-19. And two, there is no evidence that breast milk or breastfeeding transmits COVID-19 infection. Yes, it is safe to continue. In fact, we recommend that mothers who are suspected or confirmed to have COVID-19 continue to breastfeed throughout their illness and after.
in March, and I'm a breastfeeding mom myself. And I actually continue breastfeeding my son when I was sick. And yeah, I mean,
Wonderful.
he didn't get sick actually. So yeah,
Wonderful. That's wonderful to
continue
hear.
breastfeeding.
There's Yes, absolutely, absolutely. There's also really very recent report that a research group was able to isolate antibodies against SARS-CoV, the virus that causes COVID-19, in breast milk. So there's a real possibility that breast milk and breastfeeding itself protects the infant from COVID-19. There is
Right.
this possibility. Antibodies are in the breast. And in fact, this is really one of the big advantages of breastfeeding and giving breast milk, that the infections that the mother has gone through, she transmits that protection to her infant through immunoglobulins, through antibodies in the breast milk.
Mm-hmm.
Yeah.
Very interesting. There's a lot of
Mm-hmm.
benefit from breastfeeding also
Absolutely.
for COVID-19.
Absolutely. Absolutely.
Yeah, yeah. Uh, Another question is when we are talking about wearing masks. I mean, I
Mm-hmm.
am lucky enough that I can put on mask when I was sick,
Mm-hmm.
so I can breastfeeding my son. But if
Yeah.
there is no medical mask
No.
available,
Yeah.
what
That is true.
what can a mother do?
Okay. So again, just to reiterate that we recommend that when mothers who are confirmed or suspected to have COVID-19 are breastfeeding, they should be wearing a medical mask where this is possible. But really, mothers should continue breastfeeding regardless of the availability of the medical mask. And this is because breastfeeding has so many advantages. And when you compare that to the potential risk of transmission of breast milk, of COVID-19 to the infant, the benefits and harms are very much towards breastfeeding. So yes, continue breastfeeding regardless of availability of a medical mask.
Yeah, thank you, Pura. Um, we started getting more questions from the audience. But before we go there, another questions that often mothers ask is, should they wash their breast before
Mm,
breastfeeding? For example, if they just cough before they
right,
breastfeed, is that
right.
necessary?
Okay. So if she has been coughing directly or naked chest or breast, then yes, she should gently wash her chest for 20 seconds with warm water and soap, and then breastfeed. But otherwise, no, it's not necessary. And it's not necessary to wash your breast prior to every breastfeed or prior to expressing breast milk.
Right. So, for those who just joined us this afternoon, today we are talking about breastfeeding and COVID-19, the importance to
Mm-hmm.
continue breastfeeding for
Mm-hmm.
mothers who are suspected or confirmed with COVID-19. Now, Pura, we are going to answer some questions that we received from our
Mm-hmm.
audience on social media.
Mm-hmm.
There's a question
Okay.
from Feng Sui Hin. I think she tapped on what you said earlier about
Mm-hmm.
immunity from
Mm-hmm.
breastfeeding. Her question is there any advice to strengthen the immune system so
Mm-hmm.
mothers produce more uh, uh, antibodies
Antibodies.
for babies? Yeah.
Uh-huh.
Is there
Okay,
is
so
there
for,
tips for that?
okay, so right now this science is really very new, but we're really happy that we can find immunoglobulins, I mean antibodies in the breast milk. That's really good news, and that means there's a possibility that indeed the mother can transmit that protection to her infant as she's breastfeeding. As to what you can do, it will be things to improve your general health. Have a healthy diet, physical exercise, enough sleep, especially if you're feeling very stressed, they're anxious. Right? It's very important to take care of yourself. Make sure you
Mm-hmm.
also recover well from this illness, and then you can continue breastfeeding throughout. At least let us reassure you that that is safe. There's no evidence of transmission of COVID-19 through breast milk or breastfeeding.
Mm-hmm. We get a comment from Aqua Sana Dansua, who says that she's happy to share that at least there are two pregnant women in Ghana who were infected with COVID-19.
Uh-huh.
They safely delivered their babies, and the mothers
Wonderful.
and babies are doing very well, with the mothers advised to practice safe protocols when breastfeeding the babies. This is wonderful,
Hmm.
Pura. Yeah, anything
Wonderful.
you would like to
Indeed.
say?
Indeed. That's truly, truly wonderful. And all of these stories, of course, are wonderful to hear that the mothers are enabled to continue breastfeeding. There's another aspect that's also very important, especially in that first hour after you give birth, and that's skin to skin contact. And that's also very important because it improves thermoregulation, glucose control, decreases the risk of jaundice in the infant. It increases the maternal satisfaction, maternal infant bond. It has so many advantages. Not least of which, of course, is that the babies are less likely to die. So this what you do in the first hour of life, of course, is very important. Aside from that, that immediate and continued skin contact as soon after birth also facilitates breastfeeding, which of course, as we know, also has its own advantages for both the infant and the mother.
Mm-hmm. Now, from my own experience, when I had COVID, I think one thing is you feel very tired, and I think uh, different people have different reaction to the virus. What uh, if mothers are too unwell to breastfeed their
Mm-hmm.
baby directly?
Mm-hmm.
What would be the best way to feed the baby?
Hmm. Okay, so again, often mothers are able to continue breastfeeding throughout their illness. It's not possible if you are too unwell to breastfeed. The next best alternative is to express breast milk. And this can be done in many ways. This will be, of course, up to your preference and what's available to you. You can express breast milk manually with your hands or on a pump or an electric pump. The important thing to remember is, of course, again, the infection prevention and control measures. You have to make sure that if you use equipment, that they're clean and disinfected before and after you use them. So yes, express breast milk is really a very good alternative to direct breastfeeding if you're unable to directly breastfeed. Another option would be donor human milk if you have access to a human milk bank. That's also a very good option. For some countries, some cultures where it's very acceptable to have wet nursing, that's also an option, wet nursing. And then, of course, if you are in a country with high HIV prevalence, there will usually be national guidelines around wet nursing. For instance, you might need to do an HIV test or an HIV risk assessment. And then, of course, the very last option is infant formula, if nothing else is available. And then, of course, this is if you can ensure that the infant formula is safe, feasible, correctly prepared, and it's sustainable in terms of supply.
Right. Thank you, Pura. Now, talking about that, we got a question from Islam Madhabat, who asks, I assume that he or she is a healthcare worker working in working where they're probably treating people with COVID. Can they still breast pump safely in healthcare facilities where there are COVID patients?
Yes, but you have to ensure that your infection prevention and control measures are in place. And you have to disinfect and clean all of the equipment that are used for each mother, right? So that there is no transmission through droplets. In fact, this is what we will be concerned about in this case. So keep all the equipment clean. Follow the manual, the instruction manual, if it came with the instruction manual, to make sure that the equipment is always clean, disinfected, and is safe to use for mothers.
Thank you, Pura. So it is still possible, yeah, but we follow the infection prevention and control measures as usual.
Yeah, and always wash the hands before handling this equipment. Also, very important.
Yes. Yeah, I remember I was washing my hands a lot. That it's became really dry.
Yes, this is the way.
Yeah. There's another comment from Sarah Jones, who said that my toddler was presumed to have COVID-19. He had the symptoms for 2 weeks, and 1 week was particularly bad. And there are days where he didn't want to eat, drink anything other than continue to breastfeed. And that helped to ease his symptoms and provide comfort as well, because he's close to the mother. Anything that you would like to comment on this, Pura?
Yeah, that's a wonderful story, and indeed that's true. That breastfeeding in itself isn't just the nutrition for the child. There's also a lot of cuddling and mother-infant contact, and that's really important in the early years. And I congratulate her for continuing to have to provide this environment for her son, her daughter, and try to, even in these times where there's a pandemic. And here's the thing, right? I mean, probably no one, especially the new parents, probably none of them envision that they would have this very special time with their child in a time that's a pandemic, right? And that's very scary, and a lot of parents are very anxious and concerned, and probably a little bit resentful or disappointed also that it isn't turning out the way they probably imagined, because no one probably could have would have imagined that they would be bringing up their very young child in a pandemic. So I congratulate her definitely. I mean, it's important to remember that in these early years, it's also very important to nurturing environment, a nurturing, secure, safe environment for the child to grow in, to continue that responsive caregiving, continue to respond to the infant or child's cues, play with them, talk to them, cuddle, because it's really important as in these early years, as their brain is developing at a fantastic rate. It's very important to remember that parenting is just as important now, even probably even more as when we don't have a pandemic.
Right. Yeah, so I welcome again those who just joined this live Q&A today. We're talking about breastfeeding and COVID-19, and how mothers should continue breastfeeding even when they're suspected or confirmed with COVID-19, because the benefit is actually big, like what you just said, Pura. Sometimes with this outbreak, parents feel anxious, panic, and sometimes they're listening to people who said that, oh, you probably are not producing enough breast milk if you are sick, if you are anxious. Is it safe to feed babies with infant formula milk instead of breast milk?
Well, feeding infant formula milk to infants always come with risk. So no, it's not safe, and we don't recommend it. There's always risk, and the risk increase when home or community conditions are compromised, when there's increased pressure in the health system, when there's less access to health services, less access to supplies or clean water. So yes, it's you have to think about all of these things. If your option is to give infant formula, you have to make sure that it's feasible, sustainable, safe, properly, correctly prepared, and so forth. But yes, indeed, if you can breastfeed, that is so much. If you can breastfeed, that would be so much better for the child. And as healthcare workers, right, we are duty bound. We should the mothers to enable her to breastfeed, counsel her, support her on proper positioning, on latching and attachment, and all these things are able to enable more milk production also. So as well, it's important for the mother, of course, to take care of herself, be well rested, have a healthy diet, some physical exercise, if she's able, and yes, continued support from the people around her to enable her to breastfeed.
Thank you, Pura. And with that, there's a question from Farhana Sharmin, who asked for when the baby is above 6 months, so it's past the exclusive breastfeeding. Yeah. Is it still important to continue breastfeeding, or should emphasis be given on complementary feeding?
Well, certainly at 6 months, around 6 months, that's the time that you should start to slowly introduce complementary feeding, safe and healthy complementary foods, while you continue to breastfeed, because the complementary foods will not be able to give all the nutrient requirements that complementary feeding will be able to give, especially at the start. And we know that breastfeeding and breast milk continue to have advantages as you continue breastfeeding to 2 years and beyond. So yes, continue breastfeeding, yes.
Thank you, Pura. And other than breastfeeding, we are also talking about skin to skin, where a newborn usually are
Yes,
immediately put skin to skin with the mother after birth. Uh,
yes.
During COVID-19, should a
Mm-hmm.
baby still be immediately put skin to skin and breastfeed by the mother?
Yes, yes, yes. So yes, because skin contact, immediate and continued skin to skin contact, as soon after birth as possible, as soon as possible after birth, immediate and continued skin to skin contact has multiple benefits for both the mother and the infant. It improves thermoregulation, glucose control, decreases uh, and other physiological advantages. There are many. It decreases the amount of time that the mother and child stays in a birthing facility, for instance. It increases mother satisfaction, the mother-infant attachment. It has multiple benefits, and of course, it facilitates early breastfeeding, which in itself is very crucial and has many, many advantages for both the mother and the child. So yes, we do recommend skin to skin contact. The mother and child should not be separated from each other. Continue with this with kangaroo mother care. If the neonate is very sick and needs specialist care, then really the facility should ensure that the mother is able to visit and be with her infant even in this circumstance.
Thank you, Pura. We are getting some repeating questions from us who
Mm,
just joined. So
okay.
maybe you can repeat again how a mother who's suspected or confirmed with COVID-19 can still breastfeed the baby safely.
Hmm. Okay, so breastfeeding with or without multiple advantages in terms of improving survival, promoting lifelong health and development for the child. There's also health advantages for the mother. She's less likely, for example, to have breast cancer, ovarian cancer, type 2 diabetes, and the child can have a there are multiple repercussions later in life in terms of lifelong health and non-communicable diseases for the infant who's breastfed. So it's very important to continue breastfeeding. And if a mother is suspected or confirmed to have COVID-19, we recommend that she continue breastfeeding throughout her illness and beyond because of the many advantages of breastfeeding. In fact, there's new information that now antibodies have been reported to be present in breast milk of mothers who have confirmed COVID-19. So again, another advantage. And indeed, that's one of the advantages of breastfeeding and breast milk feeding, that the mother's immune response uh, is is translated. There's immunoglobulins, antibodies from the mother's previous illnesses that is in the breast milk and which then protects the infant. It's a way for the mother to pass on that protection to her infant through breastfeeding, through the breast milk. So it has many advantages, and we recommend that mothers suspected or confirmed COVID-19 continue to breastfeed throughout their illnesses, their illness and beyond. Of course, it's important to also have infection prevention and control measures while you're doing this. Frequently wash your hands. Ideally, if you can, if it's available, have a medical mask while you're breastfeeding. Clean surfaces, clean and disinfect surfaces, and cough and sneeze into a tissue, immediately dispose of it, and then wash your hands again. So very important things to remember as you're breastfeeding your child.
Thank you, Pura. So yeah, I mean, for mothers can continue breastfeeding safely. Don't have to wait for a treatment to finish when they are
Yes.
confirmed with COVID-19. Yeah, because we are getting several
Yes.
questions on that.
Yes. Yes. So
Yeah.
that's true. While they are sick, while they have confirmed or suspected COVID-19, yes, we do recommend that they continue breastfeeding. If they are not able to, the next best alternative is to express breast milk and then feed this to their child. So this is an alternative, also a very good alternative. And really, if the mother is not able to breastfeed, not able to express breast milk, once she recovers from her illness, it's then important to support her to initiate breastfeeding, support her to relactate so that she can continue breastfeeding her infant because of the many benefits of breastfeeding. And remember, there's no evidence that COVID-19 can be transmitted through breast milk or breastfeeding.
Right. And WHO has recently published a list of frequently asked questions on breastfeeding COVID-19 that you can find on WHO website. It is www.who.int. And that frequently asked questions provide information for healthcare workers and families about breastfeeding in time of COVID-19. Pura, another question is for healthcare workers who are providing care for COVID-19 patients, but also breastfeeding at the same time. Is there any specific measures that they need to take?
So, as with any healthcare worker with COVID-19 infection themselves, there are multiple recommendations about how to protect yourself and the patients that you are seeing in terms of personal protective equipment and how to take care of yourself, as well as the people you are supporting. Yeah. This is very important, and yes, WHO has lots of resources on this.
Thank you, Pura. And when we're talking breastfeeding, some questions that we receive are also related to pregnancy. What are our advice to healthcare workers for their patients going through childbirth during COVID-19?
Okay. So, so again, there are resources at the WHO website. There's also a Q&A, a very easy to read question and answer portion, all about childbirth and breastfeeding. But I think the main message is that the mother should have respectful care, appropriate care, as if she didn't have COVID-19. Of course, infection prevention and control measures have to be put in place to protect also the healthcare workers around her. But yes, it's important to remember that she needs care as much as she is pregnant, she will deliver soon. She's probably feeling very anxious and concerned about the future of her and her child. So it's important to give this kind of support to pregnant mothers right now.
Thank you, Pura. So I think we are at the end of our live Q&A. Is there any take-home message that you want to give to our audience?
Maybe just to say that that we know that breastfeeding has a lot of advantages in terms of health for both the child and the mother. And we know that there's no evidence of transmission of COVID-19 through breastfeeding or breast milk. And still we get a lot of questions about whether mothers should breastfeed, mothers should continue breastfeed. breastfeeding when they have COVID-19 infection. And of course, this is because people are afraid, right? People are afraid, they're anxious, they're very concerned, and they really just want the best for their infants, and that's completely understandable. And part of the confusion is that we tell everyone to keep 1 meter apart, right? A lot of countries are under lockdown, and people are physically distancing, and these are all good, except for the mother and her child, because this time in the early years is so precious, and it has so many benefits for the child to have breastfeeding, for the child to grow up with nurturing care and responsive caregiving, to know that they're in a safe and secure environment. So I understand that there's a lot of anxiety and a lot of confusion, but also to say that WHO brings together experts from around the world, looks at the latest evidence, and really the best thing you can do for your child is to breastfeed.
Thank you, Pura. And with that, I would also thank you who have joined us this afternoon. We have viewers from India, Australia, Swaziland, Zambia, Ghana, Singapore, Indonesia, Somalia, Botswana, Nigeria, South Africa, the Philippines, Italy, Nigeria, New Zealand, USA, Saudi Arabia, Colombia, Ethiopia, Kenya, Germany, Peru, and Oman, and many more. Thank you so much for joining us. The recording of this live, thank you. The recording of this live will be available on our social media channels. And for more information about the frequently asked questions on breastfeeding and COVID-19, you can find that on our website, www.who.int. I'm your host, Sari Satiogi. Thank you very much. Until next time. Bye.